Hey friends, welcome back. It's Dr. B, your Wellness MP. Today I just wanted to stop by and give you all a little bit about GLP-1s or the injectable weight loss medications. I'm always getting asked about low blood sugar with those medications in people who are not diabetics. Let's dive into this real quick. So if you've ever wondered why GLP-1s or GIP medications like tirzepatide do not cause low blood sugar in non-diabetics, well, here's why. Let's talk about how these medications work. So they work in three main ways. So one, they're going to slow stomach emptying so you feel fuller for longer. They're going to work on your brain to suppress your appetite and what we call food noise, or the obsession over certain foods or cravings. It will suppress that. And they also work on your pancreas. Now, there's a difference between how they work on their pancreas for a diabetic and somebody who is not diabetic. Let's dive into it. So your pancreas has cells on them called beta cells, and these cells notice when the sugar or the glucose in your bloodstream becomes elevated. These cells respond with insulin production. However, for people who have diabetes, particularly type 2 diabetes, which is what these medications like Ozempic or Mounjaro were made for, this signaling mechanism is broken. So there could be a lot of sugar or glucose circulating in the blood, but for patients with diabetes, their pancreas doesn't respond the way that we want it to. And the way we would want it to respond would be to produce insulin to decrease those blood sugar or glucose levels. So when you give someone a GLP-1 or GLP-1 GIP medication like tirzepatide or Ozempic, what it does for a patient who has diabetes is that it resets that signaling pathway, and it says, hey, pancreas, we have plenty of sugar around here. Let's start putting out some insulin. So for somebody who is diabetic or has the disease of diabetes, this medication could potentially cause low blood sugar because it's resetting the pathway. For patients who are not diabetic, they don't need an extra signaling or an additional reset because their mechanism is working just fine. So it's not going to work on the pancreas of a patient who has diabetes the same way that it's going to work on a patient who does not have diabetes. So the risk of low blood sugar with these medications in a patient who does not have diabetes is very low, if at all. Hopefully you found that helpful. If you did, please subscribe to my channel and share with your friends, and we'll see you next time.